Hi folks, Chief Brazel here. It's been a while since our last update. Of course, we're still in the middle of a COVID-19 pandemic, but I think I see a light in the tunnel ahead. To date, you have seamlessly and safely treated and transported over 1,400 COVID-19 patients. And you did this while minimizing exposures to yourself and your partners, thanks to your good attention to safety procedures and your PPE, especially wearing your masks. Now, masks. We need to keep wearing our masks as part of our daily routine when we're in the ambulance, even without patients, and even when our partners have been vaccinated. Now, I know that's frustrating, but we need to stay the course just a little while longer until we can get our COVID patient count down and our vaccination rate in the community up. Now, speaking of vaccinations, Virginia Beach EMS has been an integral part in Vaccinate Virginia Beach. We have given over 110,000 shots to date, primarily through our operation at the convention center. Dozens of EMS members, staff, medics, and volunteers have been involved in this operation in a variety of roles, both behind the scenes or on the vaccination floor, giving shots. We've expanded our scope of practice of EMTs to allow EMTs to give shots, and we created a new membership category, Volunteer Vaccinator, and that targets nurses or allied healthcare providers who just want to come in and roll up their sleeves and help get shots in arms. Now, we intend to transition out of the convention center later next week. The state is going to bring a team in and they'll set up an operation in our place. Now, beyond that, we will continue to assist the health department on smaller events throughout the summer, but our role will be much smaller than it is today. So whatever the future brings, though, I want to circle back to the larger operation, the convention center. This has truly been a historic moment for Virginia Beach EMS and the city of Virginia Beach. Just 15 weeks ago, we started with our first vaccinations, and we started with a small operation as a drive-through at Station 8, and then progressed to what FEMA would call a Type 2 community vaccination center. And while other communities were bragging or continue to brag about having a one-day event where they vaccinate 1,000 people, we were very quickly vaccinating 2,000 to 3,000 people a day, multiple days a week. It's just something that I continue to be amazed with. And we did all this, had everything in place, and we're up and running several weeks before FEMA published their guidebook on how to run a community vaccination center. This has only been possible thanks to the dedication of countless members from EMS, other city organizations, and of course the health department. I also need to mention the folks in the field and their sacrifices. Very early on, a decision was made after talking to folks that we would pull a certain number of medics and supervisors out of the field full-time to work in the vaccination center. And that meant the people left behind to staff ambulances and zone cars had to work much, much harder at a higher rate, higher demand, more calls, and it is obviously has taken a toll on everyone. But their sacrifice in the field allowed us to build this core group of vaccinators, which increased our capacity and did a great, great thing for the community. So whether you actually were in the vaccination center or helped carry that extra load out in the field, you played a critical role. And that critical role goes beyond just 110,000 shots in arms. That's just countless illnesses and untold suffering that's been prevented, and certainly lives have been saved. Now, speaking of vaccinations, I hope all of you have had your shots. The Moderna and Pfizer vaccines have been proven to be safe and effective. So if you haven't been vaccinated, I urge you to do so. We've taken out the middleman. You can now register directly, or they still have walk-in opportunities at various community vaccination centers. Please spread the word to your friends, your family, anyone you can think of. The supplies are there. Get out, get vaccinated. It's the only way we're going to get out of this pandemic. So let's talk about operations. Ambulance staffing is not where we would like it to be, particularly at night. Now, there's a lot of reasons for this, not the least of which is the impact of COVID-19 on volunteer recruiting and retention. The challenges that you're facing and you continue to face have not gone unnoticed. I mean, I've briefed City Council and the City Manager on this. We're working on ways to increase our ambulance staffing, but let me be clear, there's no magic wand we can wave that's going to get extra people on the street overnight. It takes a long time to recruit, train, and qualify a new volunteer. And of course, additional career staff can only come via a prolonged budget process. Now, that's not to say that there's no hope. I'm asking everyone to look at what they can do to help with staffing. Staff here in the building, we are looking under every rock to see better ways to get people in faster and train them faster. And I'm asking each of you to be a recruiter. Think about who do you know that might make a good volunteer? And what about the people you know that are former volunteers or on leave? Please invite them to come back. We'd love to have them here. Now, on the career side, we do have in the city manager's proposed budget 7 positions programmed for next fiscal year. That's linked to the new Burton Station, which will come online this spring. While those are the only positions currently in the budget, others have been requested and discussion is ongoing. I recently provided a presentation to the city manager and to city council on this, and I understand some of you may be engaging in some public dialogue. Final decisions by city council regarding the budget will be made in May. Now, some of you have asked whether or not we're going to be billing for ambulance services in the future. I've been involved with some dialogue with the leaders of your rescue squads for over a year now. This is an incredibly complex issue. There are many, many details ranging from who would do the billing to how do we figure out how to do the paperwork, what does that impact your volunteer status, which by the way it doesn't, and perhaps most important, how will the revenue be shared between the city and the rescue squads? And so we've been working through all of those things and building kind of a recommendation package. But please understand, the decision to bill for services is a public policy choice. There has to be buy-in on a lot of levels. Most importantly, we have to have approval from City Council. So at this point, we have not presented anything to formally to City Council or sought their approval. So at this point, I do not anticipate billing for ambulance services anytime soon. If things change, we'll let you know. And if you have any questions in the meantime about billing for services, please feel free to contact me. I'd be happy to talk to you about it. Now, on a final note, we recently published our annual report for 2020, and that's available for view on our website, vbms.com, under the About Us tab. So if you have a few minutes, I encourage you to go check that out. I think you'll be amazed about what you and the team accomplished last year. So I think that covers enough for now. I'll leave you with my usual thank you for what you're doing out there, and thank you for your sacrifices and service. I'm really looking forward to seeing each of you and your smiling faces very soon without masks. Thank you.